Welcome back. If you're just tuning in, you're watching us, Stephen and Zamil.
That's right. Now we have a hot dog. Right, hot dog in the studios.
That's right.
Short form for a hot doctor, right?
That's right.
So,
I think this is really timely that we're talking about this because there's always a bug that's going around. People coughing, having the flu. It had taken me like almost like 2 weeks.
Taken you down for 2 weeks.
That's right, and it took me 2 weeks to recover from this. But luckily, I found out that it's not pneumonia lah. It's just a normal flu from my sinus.
Good.
But right now we're talking about pneumonia, and we'd like to welcome Dr. Siti Noraisha Zainuddin, who is a medical officer from the Institute of Respiratory Medicine from Hospital Kuala Lumpur. Good morning.
Good morning.
Good morning, doctor.
Yes.
So, how common is pneumonia? How often do you see it in your hospital? No?
Well, talking about pneumonia, is basically the layman term is a chest infection. So basically, we see patient every day in and out with pneumonias as inpatient and also as outpatient.
Wow. Right. So basically, just to back to basics, right? What is actually pneumonia?
It's an inflammatory condition of the chest, or as people say, it is a chest infection. All right, it happens when your alveoli, the sac in your lungs, was infected. It will fill with fluids of pus.
Right. And what is the cause of that?
Yeah.
It could be due to viral, bacterial, fungal, or maybe some other certain medical drugs, autoimmune diseases, and also sometimes parasite.
Some say that one of the causes could be like, when your shirt is wet, then it's in front of your chest, and you don't change it soon enough. Is that a cause?
And plus in a cold environment.
I think the cool environment is one of the causes. But basically, when as your parents will teach you to change your clothes when you're wet with the rain, everything. So indirectly, I think it would be one of the causes. Right.
I see.
Right. So most people don't actually know that they can get pneumonia.
Yep.
So what are the basic symptoms that we can look out for?
Okay, usually patient will present it with symptoms like cough, with a very productive phlegm or sputum that we call. It could be from whitish to greenish sputum, and sometimes they can have blood-stained sputum.
Wow.
So fever, and they will have breathlessness. Sometimes we have just a generalized body ache.
Wheezing.
Wheezing, yes, it is very common in viral pneumonia, especially if you have underlying medical condition like asthma, chronic obstructive pulmonary disease, and other medical conditions, basically.
Okay, so how serious is it actually?
We can divide pneumonias into a few categories. So based on our assessment on the severity of the pneumonia itself. So we have this scoring system which is called CURB 65 that we use to divide patient in a category of mild, moderate or severe pneumonia. So this one depends on which category you are in. So patient sometimes may need inpatient admission, or as outpatient, can be treated as outpatient.
Do we have a picture here on the screen? So
Yes.
what's the difference between left and right?
Okay, on the right, on the left side, I'm sorry, it's the normal lung. This is what happened in your alveolar sac, where normally the oxygen changes happens. So when your alveoli was filled with pus and fluids, this is what happened. There will be interruption in the oxygen exchanges.
I see. Okay, doctor, we actually went out to the streets to have members of the public to ask some questions for you to answer.
Right.
So let's take a look at this first question.
I'm Peng Long. I'm from Nestle. The question I want to ask today is, what is working pneumonia?
Working pneumonia.
Yeah, is there such a term?
I haven't heard anything about working pneumonia. I think maybe there's something related to your work.
Okay.
All right. Sometimes you're exposed to dust. You have other underlying medical condition.
Right. Or you work in a factory.
Yes,
or something
exactly.
Like that. Is that
yeah.
possible for you to
Yeah,
get
and also
that form of pneumonia?
yep, and also if he's talking about that, maybe something to do as working hazards lah, especially the healthcare workers.
That's
They
right.
are more exposed to pneumonias.
Who are more at risk? Those who actually work in an environment where there's a lot of chemicals involved, like those people who are actually working in a like a let's just say like a paint factory, or those with or those more towards the production, like manufacturing or something like that?
When you are working at those kind of environments, you're exposed to some certain medical conditions which can later make you have this kind of lung problems. So when talking about that, I don't think there's any specifically related working environment.
Yep.
All right.
But basically the environment itself, you have to look at, right?
Talking about the environment, what about haze? Does it increase our risk when it's hazy? Is it?
Yes. Because let's say you have asthma, you are prone to have all this kind of chest infection. So haze is one of the risk factors, right? And also elderly children are the most common groups of people who will have pneumonia.
I was about to ask that. So the children and also elderly adults are more prone to get it, right?
To have pneumonia.
What about in terms of gender? Is there any difference between men and women?
No, I don't think.
Okay. Right. So what would be the latest treatment or options available? Do they have to still resort to eating antibiotics?
Not all pneumonias need antibiotics. Right? We have a few parameters to say whether this one needs antibiotics or not. All right. Sometimes it could just because of viral. Viral don't need antibiotics. So the doctor will advise you when to take your antibiotics.
Right. How do we check whether that person has pneumonia? Is it through the blood test, or is it just through an X-ray of the lungs?
Oh, all right. Basically, we go based on symptoms. If we have symptoms suggestive of pneumonia, we will do some blood investigation, the infective parameters, and also the chest X-ray. Chest X-ray basically can tell you whether you have pneumonia or not. There will be some changes.
Let's bring on another man on the street. Right?
Yeah, we have another question.
Prepare yourself.
Take a look.
Let's go.
Next question.
Hi, I'm Sarah and I'm from KL, and I have a question for doctor today. My question would be, my mother lives in a nursing home, and if she gets pneumonia, will she have to be moved to a hospital?
Alright.
Okay, good question.
So yeah, her mother is basically an elderly staying in a old folks home, right, nursing home with a very packed environment.
That's right. So, and we don't know how,
their hygiene, status, everything. So as I said before, it depends on the severity. If she needs hospital admission, definitely will advise the patient to be admitted. Sometimes her mother can just be treated as outpatient and be reviewed again later in the clinic.
Okay, right. Well, doctor, we actually have a caller, Hairi from Perak. Hello, Hairi.
Good morning, Hairi.
Good morning, Damian and Stephen.
Hi.
Good morning. Do you have a question for the doctor?
Yeah, actually, I would like to ask the doctor pertaining to the amount of patients. So perhaps the doctor would clarify further, if someone was contracted by the pneumonia illness, perhaps is that possible for them to be get over if they are going for further treatment? For example, someone get a certain symptom of pneumonia and then they go for immediate treatment, perhaps. Is there any possibility that they are be able to get over immediately? So perhaps the doctor will clarify it further. Thank you very much.
Okay, thank you, Harry.
Alright, meaning that whether this patient can be recovered or not.
Yes.
Is it?
Yeah.
Alright, basically if we treat accordingly with very good antibiotic, we hit the right bugs, that is the terms that we use in hospital. So usually patient will recover, but some patient may just deteriorate further.
I see.
Right.
What about when the patient recovers? Is there a chance for it to have a relapse?
To recur again? Yes.
Really?
Provided you have uncontrolled diabetes, other medical condition, heart problems. Those are the people that we call as immunocompromised or immunosuppressed, where their immune system is a bit low, so they are prone to get all these kind of infections.
Okay, now prevention is better than cure and treatment and any of that, right? So how do we actually arm ourselves, protect ourselves, and avoid from getting?
Do we have to wear the mask all the time?
No. I only advise my TB patient to wear mask.
Okay.
Alright, so patient with pneumonia, no. Alright, if For Malaysian at the moment, we have this immunization for the children.
Okay.
So basically, we give immunization at early age. Then later, if you have asthma, you have condition like bronchiectasis or any other lung problems or any other medical condition, we would advise the patient to get themselves vaccine, influenza vaccine every year, and also pneumococcal possible every 5 years.
Oh, so there's such a thing nowadays,
Yes.
eh?
Yes.
Okay, so how would you advise the people out there, in order to take care, especially with this really
super bug going
unpredictable,
around?
unpredictable environment.
Basically, it's hand hygiene. There's some cough etiquette. Don't cough if you're unwell. Don't cough directly to your friends. All right, have some good cough etiquette and go and seek treatment if you do have symptoms of pneumonia. You might need a hospital admission.
Okay,
Alright.
right. Thank you so
you.
much, Dr. Siti,
Thank you.
who is from the Institute of Respiratory Medicine, Hospital Kuala Lumpur. Thank you so much.